So good afternoon, everybody. It's really nice to have you here, and welcome to the seminar across the Atlantic 2025. If I'm not mistaken, this is the fifth edition of our seminar, and the topic of this year is University Lifelong Learning for Health and Well-being. Very interesting topic we're gonna cover today. I'm Pascal. I'm the president of UCAN and the director of Formation Continue ULLL EPFL, which is a continuing education foundation of the University of Lausanne and EPFL in Lausanne, Switzerland. This seminar is organized by four organizations: UCAN, which is a European University Continuing Education Network; UPCEA, which is a University Professional and Continuing Education Association from the US; AAACE, which is the American Association for Adult and Continuing Education; and CAUCE, which is the Canadian Association for University Continuing Education. I think this is the first time that we are the four of us together offering this seminar, and we are very happy about it. Before we start, just a few housekeeping requests and suggestions with the use of Zoom. Please make sure you mute your microphone when you are not speaking. I think this is the case. It's very silent right now. If you can please add the name of your city or location with your name. I'm sure you know how to do that, but it's very convenient when people ask questions to know who we are dealing with. Do not hesitate to use the chat to write comments, give references, etc. It will be used during the discussion. As we are like, I think, 35 people, it's difficult to see everybody on the screen. And also, do not hesitate to write your questions in the chat, and we will take time to answer questions during the discussion and the debate part. Today we have the privilege to welcome 5 speakers. Tricia Berry, which is a president of AAACE. HEITZMAN is deputy CEO of UPCEA. Rod LASTRA is the president of CAUCE. Matthew WEAIT is member of the steering committee of UCAN. And Jérôme FABIANO is director of EIT Health France. EIT Health was established in 2015 as a knowledge and innovation community, KIC, of the European Institute of Innovation and Technology. And Jérôme will tell us what it's about, because I think we are less familiar with this organization than we are with the others. And in a bit, Lyndsey El AMOUD, who is a member of the steering committee of UCAN, will join us as she will moderate the discussion and the debate. So the topic for today is University Lifelong Learning for Health and Well-being. So we all know that lifelong learning is key for the health and well-being of individuals in general and for healthcare professionals to do their work. If we think about individuals, we see that they can learn about health research, new treatments, healthy lifestyles, which can help them make better decisions impacting their health. The continuing education is essential for healthcare professionals to keep up with the latest development in medical knowledge, treatments, and technologies. Continuing education for professionals is often very structured and compulsory with credit systems and so on, really part of professional education. And universities are very active in the field of medical and health sciences, education and research, as they are also in terms of individuals. So considering this, today we will try with the different speakers and during the debate to answer in particular some of the or all of the following questions. What role can universities play in promoting lifelong learning for health and well-being across the different target groups? in what ways can universities collaborate effectively with key stakeholders, such as professional associations, patient organizations, and the broader public? What are the main challenges universities face in advancing continuing education in the field of health and well-being? Which examples, models, or innovative approaches would be valuable to share or are valuable to share within this group? And we will have a few from our speakers. And then also, this is also one of the objectives the seminar across the Atlantic, is to see what are the similarities, differences that we can observe between our regional context in terms of needs, strategy, practices. So this is kind of the broad perspective for this afternoon. And now, I think without waiting more, we're gonna start with the presentation. The first person to speak is Tricia Berry. Tricia is president of AAACE. She is an associate faculty at the Forbes School of Business and Technology, and also a consultant in the field. And previously, Tricia was a director of clinical and practicum programs at Purdue Global, and she holds a PhD for North Central University. So the floor is yours, Tricia.
Good morning, everyone. It is indeed morning for me in the middle of the US. I know for some of you it's a little bit later in your day, but it's good to see everyone here. And the approach I'm going to take today, since I get to go first, is just I'm going to just talk about each of the questions that Pascal has already mentioned. I do want to give you just a little bit more context in terms of my professional background. I am the president right now of the American Association of Adult and Continuing Education. And our focus as an organization is really to support the needs of adults, educators, and adults that are engaged in education, which means lots and lots of different people in lots of different populations that we serve. But in addition to that, my background, my first profession was actually in healthcare. I am a registered occupational therapist, and have been for longer than I can remember at this point. I don't actively practice in the field right now, but I have worked in healthcare education now for, we're looking at, I think, 27 or 28 years. And that's been my primary role in the institutions I've worked at, is working in healthcare. So I have a real passion for the types of things that this seminar is promoting and talking about. And as we look at promoting lifelong learning in healthcare, to me, there are a couple of different levels we have to think about. I think the first level is, how do we promote lifelong learning for just the general population, for all the people, and what goes into that for them? And then I think that second level is a little bit more of what the focus has been in the materials for this seminar, is how do we advance that for healthcare professionals, and how do we promote lifelong learning for healthcare professionals? So as I talk through my points this morning, I'm going to emphasize, try to emphasize a little bit of both of those on both sides of things. When we look at what universities can do in terms of supporting lifelong learning for healthcare, at least in the US, I think the universities help create an overall culture. And when I say universities in the US, I'm thinking about not just our state funded, our state supported institutions, but I'm talking about higher education in general. So in the US, we have some institutions that are funded through states and the government. We have some that are private institutions that are funded maybe through like religious sectors and private organizations. And then we also have some that are for-profit organizations. So when I talk about our responsibilities toward lifelong learning, I'm speaking about the industry as a whole, no matter what word I use when I talk about that. And I do think that higher ed as a whole in the United States has plays a big role in setting that tone for lifelong learning. I think within our programs, as we are educating students, we can help to promote health literacy and help to promote overall wellness, even just as an overall part of academic programs. A little bit of that might come into like liberal arts types of things, but just as an overall component of programs and the university environment, helping people learn what we call health literacy, understanding health, and how they make choices that impact their health long term. You know, the average age in overall in the world overall in the last 100 years has gone from the average life expectancy being about 35 years old to now being somewhere to 75 years old. So in 100 years, we've really advanced how long we're living. And that means people have to think differently now about the choices they make throughout their life, so that they can promote their own health and keep themselves healthy for that longevity. We also, I think, our higher ed institutions can provide a connection point for people that need to learn. Now, that doesn't maybe mean that they always provide the actual content that is being provided, but they can provide a place for people to come and learn, even if the content about lifelong wellness is being provided by some kind of outside group or some kind of partner that the institution works with. And when I say connection point, I mean not just a physical connection point where people are going to a campus and learning, but also connection points through the internet, through webinars like what we're doing today, through social media posts, through outreach as well in that. So I think those are two things that the universities or higher education can do to support lifelong learning for the general population. I don't think we can possibly promote enough the choices that we make with wellness and the choices that we make within our lives to help keep ourselves healthy long term. And that applies to all of us. Now, within the healthcare professions, I think the role of member universities is similar to what I've just talked about, but perhaps a bit more targeted. Obviously, the universities and the higher ed can provide a lot of training in new techniques and skills as things are coming along. They can be a resource for learning, and that happens a lot in the United States, particularly with healthcare. The universities also help to advance the professions and advance technology within the US. There's a lot of research done within our institutions, and they help our professions to evolve. They help us to provide better care, and they help us to learn the new skills that we need to move forward in healthcare. I think the other thing that universities have a big role in, or higher ed has a big role in, is providing support and serving as a resource. I personally, when I have an occupational therapy related question, I will still reach out to my old university, even though I graduated from them long, long ago. I will reach out to them or to people who were faculty there when I was there or shortly after I left, and ask questions at times. And so I think having that support and resource and someplace to go back to is something that's super helpful for our healthcare professionals. Another role that I think universities can play is partnering with employers and working with employers to understand where employers are seeing gaps. And I think gaps can come in a couple of different ways. Number one is, where are employers seeing gaps in terms of preparation for folks that have come into the field, or for folks that have been in the field for a long time and need to learn new skills. So the universities communicating with the employers helps them understand where there's needs, and they can create programs to help fill those gaps. And then another huge role I think universities have traditionally played in the US is being able to advocate for policy changes as needed, and to work with our legislators when there is a need for changing either the rules related to education and how education is implemented, or the rules related to how healthcare is governed, in order to make it either, I don't want to say easier to practice, but make it more effective for people to get into practice, or more effective for people to be able to stay in practice. And that kind of leads me into my next question that Pascal had mentioned is, what are the challenges encountering the field? It will probably come as no shock to any of you that things are a little chaotic in the US right now politically. And I said just a minute ago that traditionally higher education could help advocate for policy changes. Right now, in the current political climate, that's a pretty challenging thing. But it is a role that higher ed has played, and I think you will see higher ed continue to serve in that role. I think it will help us to have those advocates to help weather some of the storms that we're facing right now. As an example, like an institution might advocate with the policymakers for different types of reimbursement for certain services in the United States. One of the big things in the United States right now that's difficult is reimbursement related to OBGYN services. And also then kind of paralleled with that, liability related to OBGYN services. And a lot of our rural areas are losing OBGYN services so that pregnant mothers are having to drive a long way to get services. Hospitals are shutting down maternity units and not even offering those opportunities for mothers. And a lot of that is because of the liability and things and the costs that go into those services. But then, of course, it doesn't provide the services that clients need or that patients need when things happen. So one of the things our universities have been working to do is advocate for that, to go to the policymakers and say, you know, here's what's happening. Here's why it's happening from a policy perspective. How can you change that policy? How can you adjust it to make it, I don't want to say easier, because easier isn't the right word, but make it more efficient or effective for people to function in those roles. Costs and funding, obviously that kind of ties in with the political climate, but costs and funding are always a challenge. And even those of us in the United States who work in healthcare, those positions tend to be fairly well paid, but the cost of engaging in continuing education, it can be very expensive. And so that can always be a challenge for healthcare providers. And then I think the other thing that's a challenge for healthcare providers is that trying to balance workload with actually learning and implementing new skills can be really difficult as well. I think this is something that's universal across the world, but there's a real drain on healthcare professions right now. And even just being able to take the time to go and learn something right now can be difficult because workloads and patient caseloads are so high. And then you couple that with the fact that the pace of change is so fast right now. Things are always changing. As healthcare professionals, we can't just sit back and do things the way we've always done them, even for the last year or two, because things are changing so quickly. So it creates a dynamic where it's really challenging, and it creates a lot of kind of conflict as a healthcare professional, because you know you need to advance, but you don't have time because you have to take care of your patient. The next question that Pascal had given is examples of approaches that would be interesting to share. One thing in the United States, one organization that I think promotes good learning from a population level is something called the Osher Lifelong Learning Institute. OLLI is the acronym, because we love acronyms. And it was established in 2001. It's a consortium of 120 learning institutes. They're located in all 50 states. They're all associated with a university or college, but they're designed to promote learning for adults 50 and over. So typically what they provide is at a very low cost. They do a lot of courses and study groups and social events. They do educational travel. They're designed around the joy of learning. So within those OLLI units, they can help educate the population regarding health issues. They can educate them regarding how to traverse the systems because it's tricky in the US as it is everywhere, I'm sure. And so the OLLIs are a really, really great example of something we can do to promote good programming within the general population. And I know that my time is right at the end, so I will just say real quickly, opportunities for collaboration across other associations and continents. I think absolutely. I am always pro collaboration across all kinds of organizations. I think we learn every time I come to a EUCEN seminar. I learned something that's different that I was like, I think, gosh, why don't we do that in the US? Or why couldn't we try something like that in the US? So I think collaboration, talking to one another, learning how we do things, sharing some best practices, and also sometimes just sharing challenges, because when we talk about our challenges, sometimes we realize we're not alone in those challenges anymore. And somehow it doesn't feel quite so large when you know that other people are working to resolve some of those same issues that are challenges for you. So 10 minutes is not long to talk about all of this. But I think, Pascal, did you just want me to go ahead and turn it over to Amy? Are you going to introduce Amy?
I'm going to quickly introduce Amy. Thank you very much, Tricia, and
Yes,
also
thank
for
you. Appreciate the
looking at the time. I was about to. So the second speaker is Amy HEITZMAN. Amy is Deputy Chief Executive Officer and Chief Learning Officer of UPCEA. Amy holds a PhD from the University of Texas at Austin. So the floor is yours, Amy.
Thank you so much, Pascal. I really appreciate it, my friends. It is lovely to see each of you. And Tricia, I love the passion. I could feel the commitment to advocacy and adult learning and social justice. And this is why we're colleagues and friends and why the seminar resonates so deeply with me. My members are the staff and administration, the leadership at institutions who are creating programming around exactly the challenges that Tricia described. And so they are about 17,000 members involved in professional, online, and continuing education across the US and the world, although most of the comments that I'll share today are really US focused, in spite of or despite the challenges that Tricia did mention. The struggle is real, my friends. But for today's conversation, I'm going to focus a little bit on the kinds of things that I'm seeing in terms of healthcare continuing education. The innovations in the US around UPCEA members are really happening around what we're calling employer engagement. And we define that as co-creating credentials. Now, credential could be micro to macro, but co-creating credentials with employers, like with hospitals and healthcare organizations. And in the US, these credentials are often desegregated from the traditional degree. They often begin as stackable opportunities that are either non-credit, that standalone, or stacked toward a recognizable credit. And they're often stackable toward learner mobility. And those are some of the things that really get my members going at the end of the day. So some of the resources along these lines, since we last visited a year ago, I will share with you in the chat around employer engagement. And I hope that each of those links has come through. Yes, technology. So my friend, we have created a playbook on building capacity. So this is an example of 10 different institutional types in the US in terms of how they approached an entity within their local sector. Some of these are healthcare and some of these are not, but I share this with you because it's a playbook on how 10 different institutions approached co-creating a credential to meet market demand. I will come back to that. The second thing that I have is a framework that UPCEA is drafting. This is not ready for prime time, my friends, so I'm sharing with you something before it's even ready for press. Take it well. We have drafted a U2B framework. U2B in our land is university to business. Universities, as Tricia mentioned, are fantastic places with amazing resources. In our world, unless mission is meeting market, we are in a vacuum. And so our relationship with businesses, with employers, with the end result of where learners will then move on in terms of their mobility is paramount. And so that U2B framework is something I encourage you to take a look at. And I ask for feedback because it is still in draft form. But then we would also be nothing if we did not have an opportunity to partner with high-level corporate entities. And Collegius is a partner of UPCEA, as many of you have seen the work that we've done with Collegius. And I share with you that third piece because it's an employer's viewpoint. Institutions sometimes get in our own way and we think about things from our perspectives only. Occasionally we think of things from the learner perspective. Excellent. But one of the missing pieces has been thinking about things from the employer's perspective. So I encourage you to take a look at that report from our wonderful friends at Collegius. So that brings me to, that's sort of the role that the role that I see member institutions playing. But really what I see is that we have an incredible opportunity in terms of helping our institutions' missions meet the market. Yes, we have opportunities in terms of nomenclature. Is what we're calling a credential, is what we're calling the continuing education skill development. Does that resonate with the learner? Does that resonate with the employer? Potentially. Yes, we have challenges in terms of data and trust and quality and verification, absolutely. But at the base of all those conversations is where mission meets market. And recently, I shared this with my colleagues before when we were chatting about today's conversation. I sat down with colleagues from UPCEA from 4 institutions, Hopkins, the Colorado County Community College System. I got that wrong. I added an extra C. I apologize. University of North Texas Health Science Center, and then St. Cloud State. So vastly different institutions. And there will be a blog forthcoming in the next few weeks that recaps that conversation. But I had the conversation in advance of today because I wanted to know what they're doing on the front lines of creating healthcare continuing and professional education. And one of the things that I found so striking is how they are blending mission with today's marketplace. In particular, Hopkins, as you know, is a teaching hospital. So one of the things that they are doing to meld mission with market is that they are they're collaborating with frontline clinicians and not senior faculty, but junior faculty in their programs, those who have skin in the game for what comes next, which does not mean that senior faculty are not to be trusted nor to be included. But this was a bit of a flipping of the model of a teaching hospital. And so I encourage you to check out that blog and find ways to deeply engage your faculty, maybe not the rock stars of your faculty, perhaps the junior or the frontline. Colorado Community College System similarly has 13 satellite campuses. What they're recognizing is that not each campus can do it all. Aurora cannot do what Denver can. And so instead of attempting for each campus to do everything, they're finding ways to each lean into a particular strength to meet the market. But what they're also doing is not siloing. They're talking to each other. So if a student starts here, the student can then go here, and then the student can go here, and all of those courses are transcriptable and transferable across the system. Amen to that. My colleague John McKenzie at University of North Texas Health Science Center is doing something very similar. What he has done is he's engineered his programs to meet the shared mission of the UNT campus. How many of you are working with institutions where your institutional mission includes building healthier communities? Couple, few, maybe no, a finger here or there. I see you, Rod. Thank you so much. That is one of the things that I found so vastly important in terms of the work that UPCEA members are doing is meeting mission with market. But if your mission doesn't include healthier communities, what are you doing in terms of healthcare continuing and professional education? So we need to start with purpose. And then lastly, but surely not leastly, my colleague Elizabeth at St. Cloud State speaks very specifically about apprenticeships and badging programs that are directly connected with company promotion and hiring. And so if you are talking to local entities and you are using the skills that they purport to want, and you're badging those skills, you make that upward mobility ladder so much more available for your learner, and you keep your employer really happy because you're talking the same conversation and you're demonstrating that with an accessible badge at the end. Let me mention just a couple more things. Pascal, you asked some really excellent questions, and I'm deeply interested to see what some of my other colleagues talk about in terms of examples. I mentioned a few examples. There's one that I'm going to pop into the chat that my colleagues at the Colorado system are working on, which is badge into credential into associate's degree. We're seeing a proliferation of micro-credentials in the workforce in the US, particularly in terms of healthcare. We need frontline workers. We need folks to be able to reskill. We need folks to be able to upskill. And so instead of doing all of these in a vacuum, one of the things that the system is doing in Colorado is organizing badges that then stack into more and deeper and necessarily needed things that are in the marketplace. We also have an opportunity from my colleagues at St. Cloud State. They are taking non-credit courses and matching those to licensure and certification needs. So credit is always going to be the credit coin of the realm, but it doesn't have to be the only coin. And so let me share with you a link to my colleagues at St. Cloud State. So lastly, I have 3 opportunities that I think that we could consider as we move through this seminar, which I'm so glad. Was it you, Pascal, mentioned this is the 5th time we've done this? Amen. More cowbell, please. So I have 3 areas in particular that I really see that we could be collaborating across the Atlantic, and I'll host the next one. The first is AI. I'd be thrilled if one of my other colleagues mentioned AI. We are seeing in the US using AI and AR to create personas so that healthcare education is becoming more consistent. Tricia mentioned opportunities to meet underserved populations. This is how we can leverage AI, I think, collectively to meet underserved rural populations. The second opportunity to collaborate, we don't often invite faculty to disseminate their research among communities when that research has been completed. Why? Why can we not embed this into the kinds of things that we are seeing these folks doing all the time? This can only help uplift communities. And then lastly, I have another example. I do believe it's from my friends at Colorado. You've probably seen that our current administration is deeply interested in apprenticeships. I could not agree more. I think anytime you bring tactical hands-on education that results in a credential that is recognized internally and externally, then we have education well done. We've served all the different constituents. And so I look forward to figuring out how we can continue to make healthcare universal, but also healthcare very local. So I will pause and I will let Pascal turn it over to our next panelist. Thanks so much.
Thank you very much, Amy. We're gonna now move a bit north, move from the US to Canada. I'll give the floor to Rod LASTRA. Rod is the president of CAUCE, the Canadian Association. Is a professor at the University of Manitoba, and where he also studied for a PhD. So Rod, the floor is yours.
Thanks, Pascal. Thanks, everyone. Yeah, this is a very interesting conversation, something that I've given some thought, and certainly something that we've talked about with our colleagues across the country. Within CAUCE, this has been a topic of conversation in terms of how do we extend our services within the Canadian landscape. But I think I need to provide some context in order to do that. Number one, I think that when it comes to what we've done within the higher education space in Canada in particular, the genesis of universities, and this is not unique to Canada, but the genesis of universities in this country were schools of religious studies, arts, and health was probably the top 3. And if you look at the mission and mandate of many of the universities that were established, that was their mission and mandate. Extension schools that came from that in the turn of the century, the previous century, mandated to be able to extend the services into communities and to be able to provide education at a primary level to the public, but also to professionals as well. And then when continuing education came along, that provided a certain level of nuance in the 1960s and 70s. However, the context here is really important because, again, not unique to Canada. One of the things that we face in terms of a challenge in being able to realize and establish, the reality of a lifelong learning ecosystem is the fact that within Canada, we are primarily fragmented in terms of our mission. There is no national strategy at the moment when it comes to lifelong learning. There is no national strategy that will try to coalesce the efforts of what's being done, in particular with ideas related to healthcare and well-being. That being said, there are certainly lots of efforts being done at the provincial level, at the regional level, and I think that's one of the challenges that I think that we face as a nation is how do we, focus our attention in terms of a national point of view, recognizing again that higher education is a provincial mandate. The other, interesting context to really realize here is that when we talk about continuing education, we need to be specific in terms of what we're talking about. And what I mean by that is there is continuing education and then there is continuing education. And the difference between the two of them is that the continuing education that we represent within CAUCE are the individual units that are actually offering the skills and workforce development and civic education programming that we've been doing since the 1950s and 60s onward. But there also exists the continuing professional development training and education. And that doesn't always happen within our units. That usually happens within the professional programs that house that, that degree of training. Now, that difference and that separation does not mean that there is a dichotomy of function necessarily. There are opportunities to bring together. And in fact, many of the examples I'll talk about are degrees of collaboration with what I call the traditional continuing education unit, working with healthcare providers, working with the continuing education professional development units that are housed within those professional schools, right? So those two things do come, but you can see it's a little bit complicated. The other issue that we face is in terms of challenge is that, and this is something that I believe Amy and Tricia talked about already, is recognizing the needs of the learners, the needs of professionals. When it comes to lifelong learning and mandating the upskilling of professionals working in practice within health, one of the things that we often hear, at least at a national level, are the things that have been echoed here. Time and workload is a huge factor. There are some financial barriers. There is geographic issues of accessibility, and there is limited capacity in terms of developing programs. Now, within the Canadian context, the geographic issue is a major issue, and it's something that I would personally like to flag, because I think what we've been hearing more and more is that whether it is for primary education in terms of medicine, in terms of training more doctors, in terms of residency, or in terms of what we are calling, a continuing professional education, there is a need to look at a dispersed model of education as a whole. And what I mean by that is dispersing away from urban centers. What we do more and more is that we offer the programs within our universities. Our universities are situated typically within larger, urban centers, but we have people that work in rural communities and remote communities. Asking them to come for 4 weeks, for 6 weeks, for training is a big thing, is a big task. Now, the solution could be online. And yes, there are many good examples of online training. But when it comes to competency, and this is where, again, the nuances come in, when it comes to healthcare, the competencies often need to be assessed in person. So that's one issue. The follow-up issue, again, that my colleagues just spoke about is the degree of capacity. Healthcare providers in this country and elsewhere are overtaxed to provide and to be able to do what they need to do. Asking them to provide mentoring for residents, asking them to provide facilitation for continuing professional programming is sometimes a big ask. And for us within the units that we represent, that sometimes is probably one of the biggest barriers, is how do we get a program off the ground that we can't necessarily offer completely online. We have to offer it in person. There has to be a competency-based component. There has to be an expert facilitator to be able to monitor and assess those competencies. But those experts are busy. And so it becomes a huge barrier. The other issue is, and I'll talk about the examples in a second, is recognizing the dynamics of training. And by that, I mean, it's not just maintaining the certification and evolving standards. One of the things that we have realized, at least within the Canadian context, even though we are fragmented, is that there is also opportunities to develop new forms of training and expertise. For example, in wound care, right? In areas where we don't necessarily have to fly people to rural communities or have people come from rural communities into those urban areas. But in order to provide that, again, we need to provide the training. There's also the recognition that we need to also focus on cultural competency and safety training. This is something that is common across the country. Pharmacists, dentists, physicians across the board, the recognition from the Truth and Reconciliation Commission action number 23 focuses on the fact that we need to have that training. Where and when do we do that? All right. Amy, you talked about AI. AI is not just a tool that we use within training, right? Virtual reality, yes. Mock patients, yes. But the reality is that many practitioners need to become literate in the technologies of the time. Literate in the sense that they need to be able to provide the best care using and understanding the ethics and the standards of use when it comes to AI. And as we all know, and this could be a whole conversation on its own, the evolution and the inflection point of technology and practice and policies and guidelines, the technology is outpacing everything. So for us, keeping pace with that is really, really important. Another challenge, another issue is caring for an aging population. In Canada, by 2030, 1 in 5 Canadians will be over the age of 65. And so that is something that we need to focus and consider. And also, we need to focus, as I mentioned already, with the Truth and Reconciliation Commission recommendations, how we're going to deal with healthcare, not only within rural communities, but within Indigenous communities more specifically, working with communities, training folks who can work within communities, right? That's going to be really important. Now, to wrap up, in terms of examples, there are many examples within this fragmented landscape. And again, I don't want to leave you with the impression that just because it's fragmented, it's not working. It is working. There are many good examples. The University of Victoria Continuing Studies has a certificate program in terminology and standards when it comes to healthcare. They provide palliative care and wound care training in terms of micro-credentials. Simon Fraser, Mount Royal, MacEwan, York University all provide training for professionals, all work within communities, all do what Amy was saying, work with content experts to be able to recognize what the skills and competencies are. Within Manitoba, the U of M is primarily a healthcare institution. That's what we've done, and that's what we do best. And we have many examples within my unit and extended education. We've had the Health Careers Access Program, which has been a program that helps train and transition Indigenous students within medical fields, and we've had that since the 1980s. So there are opportunities. There are really great examples of what we're doing. What we need is a national strategy. And what I'll leave you with is opportunities for what we can do in terms of the collaborative front. Now, one quick warning about collaboration. We all talk about collaboration. Doing collaboration is a challenge because, again, we're all busy. How do we find that space? But I think with what I've said, there are opportunities to get together. There are opportunities to look at curriculum. There are opportunities to recognize that, yes, there are nuances with regulation. But when it comes to things such as AI and cultural competencies and looking at the changing demographics, I think those are common touch points across nations. And there are opportunities that maybe we can work with our colleagues, not just within our countries, but across boundaries in order to be able to look at ways to enhance our capabilities and our abilities to reach people and to provide the best possible training and education for healthcare, within our communities. Thanks, Pascal.
Thanks very much, Rod. Very, very interesting presentation. We're going to move across the Atlantic and stop in the UK, more precisely in Oxford, to listen now to Matthew Waite. Matthew is Director of the Department for Continuing Education and Professor at the University of Oxford. Matthew is a member of the steering committee of EUCEN, and Matthew studied for his doctorate in Oxford. Hi, Matthew. I give you the floor.
Hi, Pascal. Can you hear me?
Yeah, perfect.
Great. Okay, so first of all, apologies for two things. One is I thought this was going to be an hour later than it is. And so I rushed up from being in another seminar where I'm supposed to be chairing a session for the next hour. So somebody else has taken over from that. And it means that my notes are not where they should be. So I've had to kind of scrabble around. So apologies if this is slightly less polished than I was hoping it was going to be, but it's all been a little bit of a chaos. Thank you for the introduction. And it's always very nice to meet people, albeit it would have been nice to have been in a slightly relaxed circumstance more relaxed than it is. So I didn't really quite know what to focus on. I mean, so it's difficult because Oxford, where I work, is a very, very specific environment within the United Kingdom. It's what I know most about. We're talking about health and well-being. I've been trying to think and also remember as I ran up the stairs what it was that I really wanted to say. And I think thinking about the questions that you set, if I didn't catch the beginning, and I don't know whether they're the same ones that I got from Carme, but I assume they are in the earlier conversation.
Yeah.
Yeah. So I think thinking about the role of universities, I think one of the most important thing, again, this is all going to be very specific to particular histories, models, structures, funding, so on, is about the responsiveness to what I think some colleagues have thought about, which is being responsive to employer need or sector need, and creating programs in a way that makes them genuinely accessible for the audience that's supposed to be taking advantage of them, whether or not they are people who are interested in studying for their own health and well-being and cognitive health, and it's something nothing to do with health and well-being, but it's actually to do with the effects that that's going to have on them, or whether or not you're talking to early career professionals working in health or health related areas, or in people who are more senior working in health or health related fields. And so one of the things that we've done in our own university and for quite some time is that our department is different from many others, possibly more like some more North American universities than European universities in its model, is that we have in my department 358 members of staff. Last year we had 20,000 enrollments from 16,000 learners. I mean, it's a leviathan in the English UK context. But in relation to the medical and health programs that we offer, and we offer a large number of those in translational health sciences, evidence-based healthcare, pediatric infectious diseases, a whole load. The model works because we provide the support, the admissions, the rooms, the expertise in the management and organization of the program on a modular basis, because the people who are providing the content, who are coming from our medical science division, from the departments within that, they bring, as it were, the expertise, but we make it easy for them. The reason why that is important is that in a research-intensive university like Oxford, heads of department in those departments are generally less willing to allocate staff time to this kind of work than if you can provide the infrastructure and say, well, you're not going to have to worry about that. You're not going to have to bring in administrators. Your colleagues are putting this as part of their workload stint. They're doing that, and it's worked extremely well in that sense. And we're very proud of those programs, and they're on the whole extremely well. They work very well because people they can either register for the whole program, or they can register for one module. They might have to take a year off, or they go on a different rotation. They get sent to a different city and then they can come back, or they can do it online. They can do it hybrid. They come back and do it in a different modality. So I think being responsive to the audience is important, but that's specifically in relation to health care related teaching for health professionals. I do think there are some more interesting issues around, well, one thing I was interested in talking about for a relatively short time is about the benefits of lifelong learning, just generally in terms of health and well-being and lifelong learning. I mean, there is so much evidence that's coming out now about the benefits of for people throughout the life course of engaging in structured educational opportunity, and there is some evidence which is showing some correlation in some areas. I want to be very careful, an evidence-based thinker that I am, of saying overstating it, that if you put $1, €1, £1 sterling into lifelong learning opportunities for people over the age of 60, say, or 70, you would save $2, €2, £2 on healthcare costs, because healthcare is much more expensive than education. And what we need is really robust research, which takes the hypotheses and the existing research, which is good on early years education and as it were, its lifetime effect on earnings, on health, on smoking, cardiac, coronary disease and so on, because people become more enabled to manage their health, and that's what the evidence suggests. But that's also conflating with earning power and other socioeconomic benefits which come from education. So it's quite hard to unpick those. So I think one of the things the sector could do, real opportunity working collaboratively across institutions, is to think about how we could do this together and do longitudinal and comparative studies to show how this may be the case. And the reason why I think that's a priority is increasingly the only arguments that win are ones that win in the Treasury or in the finance department. You can make arguments to your education department, make arguments to, as it were, the receptive, more progressive parts of government, and they'll say, oh yes, it's terribly important, we realize that. If you can show a government that it's going to save them money, they're going to be much more likely to be supportive. It might be completely instrumental rather than from a position of principle, but I don't think that matters if what you're trying to do is ensure that people have access to those things. So I was really interested. What was the other thing I wanted to talk about? Yeah, so the positive association point I thought was really important. But in terms of the challenges and then maybe the global collaboration, I mentioned one thing there. So that one of the challenges, and I don't know whether colleagues in other universities have this difficulty, is about workload allocation. I know it's very boring. The model, the structure of lifelong learning in an institution will determine the opportunities that are available to do some of this stuff. If you have a model where you've got a hub and spoke model where it's the responsibility of a lifelong learning center or institute to encourage people in other parts of the university to participate in and develop programs with you, you've got an additional layer of responsibility and checks, which may be useful prudentially, but it can make things slower, it makes things less agile and harder to deliver. So finding out evidence from within the sector of where institutions have been able to offer programs that have worked really easily and explaining why this structure works really well and saying to the vice president or to the president or to the rector or to chief operating officer or whoever it might be in an institution, look, I'll give my own example. Oxford does it this way. It's invested in people who are actually, building up a lifelong learning hub. And they are working with this model of budgeting, of costing, and we are now currently in the have become the center for the university for the online education hub for the university and are delivering the university's online education strategy. And we are coming up with models of financing across the university where we will be co-financing and investing with partners across the university with departments that may have slightly less money, may not have that money to be able to do that, and then having a 3-5 year return model of return on investment. So I think we've talked about it in UCEN a fair amount, and Pascal may come back to it, Carme may talk about it later, I don't know, or Lyndsey may pick it up, is that we talk a lot about pedagogy, we talk a lot about, as it were, the good bits of our work, why are we teaching, who are we teaching, why do we want to reach these people? It is much less exciting to talk about budget models, staffing models, institutional structures, processes, all of that kind of nuts and bolts administration, which is absolutely the lubrication, the oil, the thing that enables this stuff to happen. And unless you get that right, you are always going to have these obstructions to being able to deliver excellent teaching and reaching the right people. I don't know how long I've gone on for because I was a bit discombobulated, Pascal, but I'm sure I can come back if there are any questions. But yeah,
you have 2 more minutes if you want to take.
Oh, 2 more minutes. Well, then yeah. I will say one more thing then. never one not to say anything. I think going back to the discussion, I can't remember who it was at the beginning who talked about what do we mean by health and what do we mean by well-being. UNESCO has been unbelievably clear, hasn't it, about democratic citizenship and about sustainability. I think it's important to think about individual health and well-being and community health and well-being, but we need to think about planetary health and well-being. And I mean that from a kind of civic perspective as well as from a planetary health, ecological sustainability perspective. So lifelong learning as a continuing opportunity to teach those people about the continuing challenges to those fundamental parts of what it is to be an effective human being in this very vulnerable environment that we live in. politically and physically in this world at the moment, I think is absolutely critical to us. So if we are going, if I was going to sort of one takeaway, it would be, say, for me, lifelong learning for health and well-being is critical to enable us to care for this finite resource, these finite resources, and those finite resources may be political as well as physical, and those challenges. So that's where I would want to end. That's probably my 90 seconds. I'll shut up now.
Fantastic. Thanks a lot, Matthew. I just want to draw your attention on the fact that there are some great resources being shared in the chat. So have a look at them, and maybe I don't know, Carmen. Maybe we could sort of take note of all of those to share them, because
I'm taking everything, and we will share it.
Otherwise, we are all just trying to take them down on the computer. So we're gonna move west a little bit, go to France, where Jérôme Fabiano is gonna speak. Jérôme is Deputy Managing Director at AIT Health. You're gonna have to tell us what it is, Jérôme. Huh? I'm sure we're gonna do it. And Jérôme studied for a master at the Schema Business School. So the floor is yours, Jérôme.
Yeah, thank you, Pascal. Thank you to all for inviting me. As you can see, I'm not a specialist like you of pedagogic engineering and university. I'm representing the European Institute of Technology, which is a Horizon Europe instrument of the European Commission, aiming at financing health innovation with an objective of creating impact for healthcare systems and their capacity to be more resilient, more efficient, based on the capacity that we have to develop and integrate health innovation. And our philosophy is based on what we used to call the knowledge triangle that you maybe already heard of, which is about integrating into a continuum educational activities with research and innovation activities and business creation activities. So what does it mean concretely? It means that we are, of course, starting from the competency, the skills of our members, whatever they are, from industry, from startups, from universities, from research centers, to develop product solutions, innovative solutions that we are validating from a technical, technological, clinical perspective, and trying to bring it on the market to create business value at the end, with some concrete use for patients. So just to give you a short idea on the figures, so we've been investing about 200 million euros since 2016. We did finance about 160 projects of innovation, and beside of that, we also finance educational activities, up to 70 educational programs. I will come back on that. And we did support about 1,600 startups in their journey to access to the market and develop a product and so on that makes a difference when it comes to patients. So, of course, you can see that education activities are very important for us, because with innovation is coming the need for understanding of industry players, healthcare professionals on the way that the best way to use this innovation. And we are today two main streams when it comes to educational activities and portfolio of educational activities. One related to supporting entrepreneurs. And we have a very strong collaboration with universities, because at least in France, they have very strong ambition when it comes to have more entrepreneurs coming from university, and there is clearly a need for structuring new pathway and cursus for entrepreneurship in health. And on another side, we have a quite good portfolio of content and educational program when it comes to educate healthcare professionals all along their career. It's not only on the initial training. So just to testify a bit about our journey, I think it's interesting for you to know that we, as I told initially, we did finance a lot of master and PhD, but very soon we did realize that it was an issue, because we were financing a very interesting educational program related to very relevant topics, but it was taking about, let's say, between 2 and 3 years to set up the educational program, to have it validated. And in terms of pedagogic engineering, it was a lot of commitment from our university partners. And the duration of our funding was up to 3 years. So you can imagine easily that there was no real return on investment for us in financing such a master and PhD program with a duration of 3 years, and the education program were only starting after 3 years of funding. So it was an issue. And the second issue that we had was that we had not enough people trained in comparison with the need that we were identifying on the market and within healthcare organization and so on, because we had I don't know, maybe 6,000 PhD and 60,000 people trained at EU level, but this is clearly not enough. So of course we are working a lot with university to see how to improve this. So what we decided is to change a bit our approach and to work more on integrated module, on certified pathway and curriculum that we did finance for creating content module that can be directly integrated into existing courses managed by our university members of the network that we are animating at European level. And this is facilitating for us, of course, the KPI related to the funding of educational program in terms of volume, but also the number of people that we are able to train, and that's a bit of our journey when it comes to educational activities. Now, trying to answer to the different questions that you raised, Pascal. You can guess easily that the role of the universities that we are working with when it comes to develop this educational program is to support us in the content creation. And of course, they're interested in the funding that we can provide when it comes to create this content, and not only in terms of format, but also in terms of language and in terms of capacity that we have to connect them with relevant industry players. For example, I have in mind one module that we did finance about how to buy innovative solutions with hospital buyers, which is a very strong need when it comes to integrate innovation. So, and of course, there is a need also for the people behind the healthcare professionals to know what does it mean to go with this process of hospital buyings, which is very administrative, very heavy, and to understand also a bit of the constraints that the hospital buyers have when they are asking for a new innovative solutions, because it's quite an important barrier. So this is the kind of things that we are doing now with our members. The other things that we are doing with universities, trying to support them on the capacity that they have to anticipate on the need for new skills or new talents based on the portfolio of activities that we have related to startups, related to innovative projects. We are well positioned, let's say, for having this role of observer and to map in some way the trends that are emerging when it comes to technology, for example, or scientific trends. And what we are trying to do as well is to help them to communicate more about the vocational objective, because clearly we identified that there is a lack of awareness at the quite early stage of the career of PhD, especially when it comes to the next step in their career. So, and what will be their need in terms of upskilling at the longer term. And what we are trying to do is to organize events with universities, like the one we will organize in November in Paris, which name is a Career Pass event. It's a graduation ceremony for having, of course, the possibility to meet with the students that are going into the educational program that we are financing. But it's also an opportunity for us to give them more perspective on their career opportunities at a longer term. And we are bringing together industry players, learning societies, hospitals that they will be working with to understand more about the challenge that these organizations are facing, and to make them think about some topics that they could be focusing on at a longer term. And I don't know if I have the time maybe to add some things on on the approaches, interesting approaches that I had identified. There is one which is very interesting, I think, in France, which name is Compétences et métiers d'avenir, competency and jobs for future, which is led by the government. It was based on the France 2030 strategy. So it's a strategy of investment when France decided to invest a lot in innovation, but they have also decided to invest into the training strategies in the different courses related to innovation and health into universities, because they think that there is a gap today in the skills that healthcare professionals have or should have in comparison with the need and the innovation happening on the market. So there is a quite high level of ambition with this national plan of compétences and métiers d'avenir. And for example, there is one project related to the need for having more experts in the regulatory fields, because you know that EU is developing a lot of regulation when it comes to health technology, use of health data, for example, with the European Health Data Space. And this is the kind of topics that they are trying to address with this national funding and with this national strategy, how to give and equip the different healthcare professionals when it comes to the knowledge that they have on EU regulation that are already into force or that are coming into force in the upcoming years. So it's a way to prepare them much more. Another initiative that we've been developing is the skill sync, which is about giving some tools, AI-based tools, to anticipate and to map a bit about the trends when it comes to the needs of the industry in terms of talents and skills. So it's AI-based tool, which is basically benchmarking the curriculum of different people working in the same kind of organizations. For example, let's say, I don't know, startups that are working in the field of cardiovascular disease. Who are the experts that they are working with? What are their curriculum? Where are they coming from? What would be their need? And what is the upskilling strategy of the different organizations that are active in this field? And what's the best practices and so on. So this is, I think, an interesting tool to look at when it comes to anticipate the needs of the market. And the last interesting approach for me is about our innovators community, which is the alumni platform that you are using, but we are also animating with platform with opportunity of project collaboration, and not only in terms of let's say events or just networking activities. And I'm very convinced that this idea of mobilizing talents and skills related to very concrete and specific project makes a lot of sense. And it's also a way to share some knowledge and some good practices at individual level. And it's creating, I think, a good dynamic for promoting some new educational program in a lifelong learning perspective.
Thank you. Thank you.
Yeah. And the last things, sorry, is that we are about to develop is more relationship with professional associations, students association, learning societies, because I think that this kind of not close community, but let's say specialized communities is very relevant to promote educational program, in general.
Thank you very much, Jérôme. And sorry for stopping you, but I wanted to keep at least 20 minutes for the discussions. And we are aware Matthew is going to have to leave in about 10 minutes. So if we have questions about Oxford and the UK, we'll do it within the first 10 minutes. And only one person can do this. It's Lyndsey El AMOUD, who will moderate the discussion. Lyndsey is Deputy Director at AAACE University College Cork, member of the UCEN Steering Committee, and Doctor of Education from the University of Oxford. Hi, Lyndsey.
Thank you. Thanks, Pascal, and lovely to join colleagues from all over the world. It's great to see so many familiar faces. We've had some very engaging discussions so far. I want to take the chance to open the discussion to members who are online who haven't spoken yet. So if anybody has any questions, you can pop them in the chat and I can read them out, or please feel free to raise your physical or virtual hand, whatever you prefer, and we can get the discussion started. So just to give a brief recap of what we've been looking at this afternoon, I've been vigorously taking notes as everybody was speaking. So looking at how the discussion has progressed in terms of what the role of the university is, all of our panelists were able to come at this from different angles. So in terms of learners, we're looking at how we can promote wellness and health literacy among all of our student body, not just our continuing education students, but all of our undergrads, our postgrads. Looking at how we promote lifelong learning in general to all of our students, and the importance of engaging in learning throughout life. As Matthew highlighted, the positive association that is somewhat documented around between learning and health, particularly learning in older life for aging populations. At a community level, then I suppose there's been evidence of the role of the university and the importance of outreach activity into communities, particularly around marginalised groups, Indigenous communities, the role of disseminating the research, the wonderful research that happens in our universities, getting it out beyond academic journals where we're all in an echo chamber, just academics learning, but actually disseminating that out into the wider community. For the professions, it's the upskilling piece, the reskilling piece, advancing the technology, advancing the professions. And then for society at large, really, it's advocating for policy change as needed. So I think these are very weighty responsibilities that we hold in university, and we have a lot of potential of making people's lives better, which I think is what we're all generally trying to do as educators. When we look at some of the challenges that have been discussed this afternoon, again, we can break them down into different levels. So if we look at maybe challenges that are arising at a national level, some of our speakers have highlighted things like political climate, issues around geographic accessibility, issues around the development of national lifelong learning ecosystems, the level of coordination that happens at a national level through policy, etc. Changing demographics is something that many of us are struggling with in both North America and Europe as we deal with aging populations. And as with all lifelong learning, I suppose the challenge of trying to not leave anyone behind, again, those marginalised groups, those Indigenous communities. At the university level, the challenges are typically around finance, funding issues, budget models, staffing models, workload allocation, how lifelong learning is organised in our university, as well as the capacity of our staff to develop new programmes. And at the learner level, we've got issues around cost, being able to pay fees for programmes, and the big challenge of balancing work and study for these very busy professionals. What was very interesting as I was capturing all of these challenges is I don't think they're unique at all to the health and well-being space, but actually quite typical of university lifelong learning in general, and they're issues that we all struggle with regardless of the discipline. So I'd be very interested to hear from either our panelists or from our audience today, how can we tackle those challenges? I mean, a lot of them we are speaking about for quite a long time. How do we take things forward? If we take Matthew's point, and I know he's been quite cautious about it, but there is evidence out there to show that link and that correlation between learning and positive health benefits. If we understand that that is true, or if we take that hypothesis as true, I suppose, how do we, as educators in the lifelong learning or in the continuing education space, try to get over those challenges that we face to ensure that we can reach more learners and reach out into communities to benefit more people in our societies? Is there anyone from our panel that would like to tackle that or maybe add something? Matthew, go ahead.
Thanks, Lyndsey. Just very quickly, because unfortunately, because I've got to now lock up a building that isn't my building, I have to go in a bit. But one of the things that I think is really exciting, and we haven't done it yet, but I think we should be doing it, is to use hospitals and healthcare settings much more effectively as ways of doing short, sharp, or potentially longer things for either chronic patients, people who are otherwise ill in hospital and in long stay, or their families, friends, and visitors. And in a previous incarnation, we used to run Spanish classes, not in Oxford, but at another university I worked at, for railway workers through a union learn model. And the reason is they went on holiday to Spain, and it wasn't necessarily that they wanted to learn Spanish, but being in community, learning something that they didn't know about was really important for them. And they came along and they really enjoyed it. So I think there's some really interesting things about place and space and where you do this work, how you take it to the environment where it can be more effective than thinking about necessarily the digital or physical, where we tend to think of the classroom or online. There are other places where these things can happen, as you know, Lyndsey, from the work you've done in Cork. But that's all I would add to that. That's one way of thinking about it.
Thanks, Matthew. And I think that goes to the core of some adult education theory in terms of meeting our learners where they are. And I think we think about that a lot of times in terms of their ability, but maybe we need to think about it in terms of where they are physically as well. We've had an initiative in our university at the moment where we're working around some piece of sustainability education, but we're training taxi drivers and we're training hairdressers because they're interacting with the public. So there's no reason why we couldn't be doing the same in terms of topics around health literacy with taxi drivers and hairdressers and barbers, people who are interacting with the general public. So I think that's really useful. Thanks, Matthew. Coming to some of the other panelists, Tricia.
Yeah, I'm going to go at this from just a little bit different angle from Matthew, but I completely agree with everything he said. And there are so many things that all the panelists said that I have pages of notes myself. There are so many commonalities. But I think when we think about changing lifelong learning attitudes towards lifelong learning and attitudes toward health, it has to be a systems change, right? And Lyndsey, you've kind of articulated that as you walk through all these different levels. And I think one way as educators we change the system is by helping the people we're educating understand that bigger picture. I don't think any one person can change that, or very few of us have enough power to change things on our own. But if I can teach 10 of my students those concepts and they teach 10 of their students or 10 of their patients those concepts, it's sort of that ripple effect where things move outward. And I think we have to train our culture somehow, or our thinking to be more dynamic. And when I think about that, I think about my mom and my mother-in-law in terms of their health and how they approach healthcare. They have an issue, they go to the doctor, they expect the doctor to give them an answer, and then they say, okay, and they leave. And then they call me and say, well, he said this and I didn't understand it, or I don't agree with it, or I don't think they thought about this. Well, why did you not say that to your doctor? Because I can't help you with those things. Well, they didn't say that because they were raised in a generation where you didn't question. The doctors were authority. You listened to what they said and you accepted it. I think culturally, we have to train people to be respectful, but to ask questions. And I've talked with both of them about asking a question is not disrespectful, and you have to ask those questions to advocate for yourself. But if we don't build that culture and we don't teach people to do that for themselves, then they can't approach their healthcare system and they end up being a passive participant. It's much like we empower our learners, right? We have to empower our healthcare our patients, our people who are seeking services. We have to empower them to ask the questions and advocate for themselves and let them know it's okay, because traditionally culture has not let them do that.
That's really interesting, Tricia. And I think when we're looking at this topic of health and well-being, continuing education and lifelong learning, it's very easy for us our minds just to go to the professionals and how do we upskill the professionals. But I think it's society in general it's everybody, all of us engaged with issues around health and well-being, and it's that idea of the informed citizen, I suppose, and the informed participant in health as well. So that's really interesting. Rod, coming to you next.
Yeah, no, I think I would like to echo exactly what Tricia just said. I think excellent point. I think this is exactly what we need. I've been advocating for a long time over the idea that in some ways we need to go back to our extension roots, right? In Canada, we had, schools of extension where what we did was had faculty go out and provide lesson plans, provide basic civic education to the masses, not to professionals. And I think we live in a time now where I think healthcare literacy is really important. I just to echo what you said, Tricia, my mom went to the doctor, she got back some blood, results, and her cholesterol was high and she was concerned. No other doctor said that. I looked at it. Now I have a background in biology. I'm not a medical professional, so just caveat. But I was able to interpret it and realize that no, the way the numbers were is that the good and bad, cholesterol, when you look at it, the net result was high, but it wasn't high in a health, concerning kind of way. I think that we need to train people to empower them to be able to be advocates for themselves, not to be able to make critical, medical decisions. That's why we have experts, but to be able to have those conversations, to be able to interpret blood results, to be able to do what they need to do to deal with that. And I think in some ways, oddly enough, that would alleviate the pressure from our healthcare system, because it would provide people with the basic foundations of what they need. And that basic foundation, I find, is missing at this moment in time.
And how do we do that then, Rod, in universities? Because are we going to come back to the typical old challenges of this won't make money? So how do we make it work?
Well, and very quickly, that's exactly the problem that I think we're all facing. Universities right now are doing more with less. I think, funding is restricted, but I think that we need to find what our mission is, what our focus is going to be. And maybe this is where collaboration comes in. We can't do it, on our own. One last thing I will say is that not only healthcare, but I think we also, as professionals, as faculty members, we need to start, taking control of the narrative. And I think far too many others are taking control of the narrative when it comes to issues, and are really creating a political climate around that. And I'm not going to get into the specifics of that, but I think we all know, my colleagues in the US, exactly what I'm talking about. So I think that's a really important thing, but maybe this is where collaboration helps, because we can't do it alone.
Absolutely. And I just saw a message popping up from Carme, project. Absolutely. And this is something that perhaps we could look at among our networks, because it's a universal issue, and something that we all do need to try and address somehow without being bogged down in the usual challenges that we have in the universities. Jérôme, I see you were trying to come in as well.
Yeah, no, it was just two very quick comments about health literacy for people in general. We had a very important colloquium last week organized by the Ministry of Health related to disinformation and the fact that it's creating not only healthcare issues, but also political issues when it comes to, for example, improving healthcare system, using some technologies or sciences and so on, for everything you know about COVID-19 and so on. But now there is this concern which is official from the French ministry, and I'm sure that there are some activities that will come from this. And the other comment was related to the mention I was making about association and professional association and mutual recognition when it comes to competencies and auto certification in a way of, let's say, a guild. And I think this model is very interesting because they have a system in international society to have auto certification every 2 or 3 years. And I think this model is very interesting when it comes to lifelong learning.
Absolutely.
Anyway.
Yeah, that would be great, Jérôme. That would be great. I think the issues you're raising there around misinformation and the amount of information people are presented with, firstly, and then being able to have the information literacy tools to understand what's valid and what's not. My sister is an emergency medicine attending, so she's frequently confronted with the Dr. Google syndrome. and regularly, and we all do it, even as her own siblings. You know, I've looked at Google, I've got a pain in my head, do I have a brain tumor? You know, and on all those questions. So there's a lot of that happens. So I think there's something kind of bubbling up under the surface here from all of us talking about, you know, is there something we can do in the continuing education, lifelong learning space around patient self-advocacy, the misinformation, the health literacy piece, that we may be able to come together and work on. Amy, sorry, Jérôme.
The main idea was about cognitive trainings and the need for developing specific skills related to neurocognitive behavior in general, and that's something that the Brain and Mind Institute, I know in France, is working on a lot, and how to empower citizens and people in general, and awareing them about neurocognitive bias and these kind of things.
Yeah, really interesting. Yeah. Amy, I saw you popped something into the chat, but I've now lost it. Do you want to come on and make your point?
I think my colleague Elizabeth, but also Rod noted, part of our challenge in the US is everything that we've mentioned, but also make money at the same time, be entrepreneurial. So we are seeing the similar challenge in trying to treat the whole person at the whole time. We're trying to treat the whole university. And so those are some dual and often opposed challenges. So I resemble all of this. Thank you.
Thanks, Amy. Is there anybody else online who would like to come in and make a point or ask a question, comment? There's a few people making some points in the chat, so thank you very much. We can share the chat after, I think, Carmen, yes. So in terms of how we collaborate going forward, I think there's been some ideas there about working with people in general. I know Matthew was making some ideas earlier about perhaps looking at the opportunity to do a longitudinal study and some comparative research, trying to create that evidence base, or I suppose add to that evidence base of the linkage between lifelong learning and health and well-being. So I think that's also something that we should consider. I mean, I don't know if any of our panelists want to contribute something on that, if any of you are aware of relevant studies or things that we could involve there.
Maybe just one thought, that it's clear, I don't know if it's an evidence of a link between well-being and lifelong learning, but it's clear that there is some mental issues that are raising because of lack of upskilling in organization. And clearly in France, it has been identified as a very strong priority for workers to act on this level as well, to improve mental health conditions of workers.
Yeah, I think it was something that came out very clear from a lot of employers after the COVID pandemic, around building resilience and well-being among their staff, and the level of stress that we all deal with on a daily basis. Carmen, I'm not sure, are we finishing at 3:30 or at... sorry.
I think if there are no more questions, and maybe we could make the end, yes, but
perfect. So just to thank everybody who's been online, to thank our panelists especially. Carmen, I know you want to make a couple of points just before we finish up, so I just want to thank everybody, and I'll hand over to Carmen.
I only wanted to point out that some of the universities in the region are organizing the Summit on Continuing Medical Education. It's going to be here in Barcelona in the month of May. Amy will be one of the guests. I think that maybe Elizabeth also is going to be here, and Pascal and Lyndsey will be also in the panels. I'm not sure if there is a lot of time yet to register because it's quite full, but the objective of this summit is to make a periodical activity. So if this is something that you are interested in, I suggest that you get in touch, or you follow the link and you get in touch with the organizers, because if it's not for this year, for the future, it will be possibility to be part of this big activity. And the other thing that we wanted to do before we go, and maybe Gemma can help me there, is to launch a very, very short quiz. It's only 5 questions and you only have to tick, 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 and that will be quite helpful. We are collecting a bit of data of who is attending our event. So Gemma, if you want to just launch it.
I would have a question if there would be time. I was just not able to find the dot to raise my hand. Is there still 1 minute?
Yes, please.
Okay, because I just wanted to know how the things can work out like in reality. For example, me, I'm working in the space of further education, human resources. And so like working in my university, it's quite easy. I have all the tools and everything, but if I should go out and we should like collaborate and everything, I wanted to ask how other people are doing it in practice.
So collaborating with who?
So it's like in general, when you say, okay, you also should do like capacity building or community building outside. It's like I have my resources that I can deal with all the people like of my university, with my students and my people and everything. Of course, we are also having programs that we can also like reach out outside, for example, concerning like chronic disease or like, other programs. But like in general, that you also have an impact like to the community. And also the other way around. So maybe, I don't know if some people here have like hands-on for the, to convert it into the practical day life.
Does any of our panelists want to come in? Rod, do you want to speak about maybe some of the activities with the Indigenous communities? Because that's reaching out. How do you reach those people? How do you collaborate? Is it through civil society organizations or NGOs or?
No, actually, we have within our own unit, we have people that work with communities. We build relationships, and normally we harness, the ability to be able to kind of have those communications, and that takes time, that takes effort, but that's how we do it. So it's really not going through an NGO; it's going through someone who has established kind of a years of relationship building with these communities.
Great, thank you. Just from our experience here, Sophia, we work a lot with organizations who are in the communities, who already have the trust, particularly of marginalized groups. Not that they're gatekeepers, but they're trusted groups for trusted organizations for vulnerable groups. So we, I suppose, very much partner with those to reach out into the communities.
Mm-hmm. So is it then actually also more that you are like bringing all your knowledge outside, but is it also like then bring it back to your university? Or is it just that you are like creating an impact to your community, and then in general, like you are elevating all the healthcare system in general?
Does anyone else want to take that question?
I would, if I may, Lyndsey,
Yeah.
I would say that, I mean, one way also to work with the community is really to be an actor, to be part of the ecosystem, and to work with the other stakeholders on initiatives. And I mean, we have example like the Learning Cities initiative, where really the university is one of the actors, working with community and other actors, and together trying to have an impact.
Great, thanks, Pascal. Okay, any other questions? This is your last chance. No. Okay, Pascal, I'll hand over final word to you.
Yeah, thank you, everybody. I want to thank really all the presenters. I mean, I also took a lot of notes. Advocacy, co-creation with employers, national strategy, also thinking about the finance organization within universities, business value. It was really very, very rich. So I want to thank all the presenters, all the participants, you, Lyndsey, as a moderator, and also obviously the UCEN Secretariat, which made all this possible. One last thing, don't forget the UCEN Conference 2025 in Lille, 4 to 6 June. I mean, it's going to be a lot about collaboration and ecosystems. So a lot of the stuff we discussed today will be discussed and explored during the conference. I wish you a great end of the day or beginning of the day, depending where you are right now. And we'll see you, I mean, either in one of our conferences of the 4 organization, or, I mean, for the next Across the Atlantic seminar. Thank you very much, everybody, and have a great day.